Inside a Venezuelan public hospital. The disaster that this country is facing is all too clear here. There's barely any running water, a lack of basic cleanliness, hardly any medicines, and, the day we were there, no anaesthetic in the entire hospital. But there is another shortage, and that's doctors. The Venezuelan Federation of Doctors says that 16,000 have left this country in the last 12 years. Efraim Vegas is head of this hospital's resident doctor association. He tries to persuade his colleagues to stay, but it's not easy, given just how little they earn.
We here in Venezuela, we are making less than the minimum salary of any country of Latin America or of the world, like doctors. We earn like $1 each day.
Dr. Carlos Leon is trying to leave Venezuela. It hasn't been an easy decision.
Does that sadden you? Would you prefer to stay in Venezuela?
Yeah, of course, because it's not easy for us as medical doctors to be able to practice in another country. So it's usually 2 or 3 years, like an average, to be able to be a doctor elsewhere. So probably during those 2 or 3 years, you have to work like in a diner and do some other thing that we prepare ourselves to be doctors.
This country's political crisis is making matters worse. In this ward, the patients told us that tear gas to suppress protests had entered the hospital twice in the last 3 days. Outside this centre for medical research was closed because the entire area had been looted the previous night.
Many of the people we spoke to here said their concern about the shortage of doctors in Venezuela is not just for the short term, but for the long-term future of medical care in this country.
Importing medicine or cleaning up hospitals could be done in a matter of weeks here, but persuading the doctors to come back may take far longer. Stephen Gibbs, CGTN, Caracas.